So, good morning, ma'am. By the way, my name is Vanji Bulay, together with Stephanie, Melrose, Jerlyn, and Janice. So, our assigned topic was all about postpartum hemorrhage. So, would be the table of contents, which introduction, definition, etiology or risk factors, signs and symptoms, laboratory or diagnostic exam, treatment management, prevention, and lastly, the nursing assistant responsibilities. So, introduction. About 1 to 5 women in 100 who have a baby, 1 to 5% have postpartum hemorrhage. So, postpartum hemorrhage or PPH remains as the leading cause of maternal morbidity and mortality worldwide. So, talking about morbidity, it refers to an illness or disease, and it is the condition of suffering from a disease or medical condition. And mortality, it refers to death. So these both terms are often used in statistics. So it accounts for 13% maternal deaths in developed countries and 28% of maternal deaths in developing countries. Further, this proportionately affecting those in the world poorest countries. While avoidable, the Philippines is still among the countries with high maternal deaths. In 2015, 114 deaths per 100,000 live births were registered in the country, a far cry from the target of 52 deaths per 100,000 live births. Of these deaths, there are 30% were reportedly associated with postpartum hemorrhage. So as you can see na usa sa taas ang maternal deaths ang Pilipinas. So, the highest number of deaths recorded in Calabarzon. So, the top 3 regions in terms of number of registered deaths by usual residents were Calabarzon, which there are 91,969 deaths, 14.8% share. The second one would be National Capital Region or in NCR with 78,599, 12.7%, and Central Luzon with 74,374, 12.0%. The combined share of these 3 regions was 39.5% of the total registered deaths in 2019. So, makita na ito diri sa percent distribution of registered maternal deaths by usual residence region Philippines in 2019. So, dito siya makita. O kinsa ang kinatasan o kinsa pud ang kinamabaan. So, definition. So, postpartum hemorrhage is also called PPH. So, kana siya occurs when a woman has heavy bleeding after giving birth. So, it is a serious but rare condition. Mo ni siya, but ipasabot ani nga mao kung ang usa ka babaye adunay grabe nga pagdugo paghuman sa iyang pagpanganak, kini usa ka seryoso apan talagsaon nga kahimtang. Bali, ang buti pasabot ani kani siya is seryoso kani siya nga sitwasyon nya mer panalagsaon ni siya mahitabo. So kini usa ka seryoso apan talagsaon nga kahimtang. Kasagaran kini mahitabo sulod sa usa ka adlaw human sa iyang pagpanganak apan kini mahimong mahitabo hangtod sa 12 ka semana human sa iyang pagpanganak. So, it is normal to lose some blood after giving birth. Women typically lose about half a liter or 500 milliliters during a vaginal birth or about 1 liter or 1,000 milliliters after a cesarean or also called a cesarean. So, a cesarean is an operation in which your baby is born through an incision your doctor makes you abdomen and womb or uterus. So, the incision made in the skin may be up and down or vertical. Muna siya sa cesarean. Mostly, ang cesarean is may tabo kini sa katong manggagmay sipit, then mostly is dili sila ka sarang bali sakit na guro sa ilang pag-utong nga bali dili na jud nila makaya then maglugos sila ka ginhawa. So muna i-undergo nato pod og cesarean ang usa ka mama. That is all. So for the continuation, early postpartum hemorrhage. So first is uterine atony. The myometrium fails to contract and the uterus fills with the blood because of the lack of pressure in the open vessels of the placenta. So when we talk about myometrium, it is a middle of layer of the uterine wall consisting mainly of uterine smooth muscle cells, which is also called uterine myocytes, but also supporting stromal and vascular tissue. So, next is laceration. There are two types of laceration, which is vaginal lacerations and cervical laceration. So, when we talk about vaginal laceration, occurs when the baby's head is coming through the vaginal opening and is either too large for the vagina to stretch around, or the head is normal size but the vagina doesn't stretch easily. So, understandable man siya, no, sa vaginal laceration. So, dali ito na masabtan kay tungod dali ka siya bali ang mga ang definition is bali makasabot dala at mga catch up dayon ba ug unsay but ipasabot. So next is cervical laceration. Most presented in the lateral conical. Rupture of the cervix is characterized by persistent bleeding from a contact firm uterus. So as you can see the fourth picture here, the first degree of vaginal laceration, which is makakan mo is gamay ra ang gisi, and then the second one dako-dako siya, and the third one ni dako-dako pud siya, and then the fourth one dala na siya ni big. So kana siya is may tabo siya sa, for example, no, namagay pag ang pregnant women, so if ever nga hapit na pud siya mga anak, like example, avoid yun na siya nga mo eat og mga sweet foods, and then also anang mainom og mga cold water, kay that's the possibility nga si baby mo big, so there na ta magkalisod pag panganak. And then there are some women nga gamay ang ilang area sa ilahang vagina, and then napoy uban is dako, pero depende yun na siya sa size sa baby. So, there are 3 degrees of the cervical laceration. So, the first degree laceration is when the length of the cervical rupture not over 2 cm. And then the second one, degree laceration, length of rupture is 2 cm but does not extended for vaginal fornices. And then the third one. So, the third degree laceration, rupture area extend to the vaginal fornices, and then if extend to vaginal fornices, very dangerous. So, second, late postpartum hemorrhage. So, in late postpartum hemorrhage, first will be the retained placenta fragments. So, in retained placenta fragments, there are 3 stages. So the first stage is when to begin to experience the contraction that cause changes in your cervix to prepare for delivery. And then the second one is when the baby is delivered. And then the third one is when the deliver the placenta, the organ responsible for nourishing the baby during pregnancy. So last would be the subinvolution. Subinvolution is a failure of the uterus to return to its normal size following childbirth.
Good morning, everyone. So today my topic is all about etiology or risk factors, causes of uterine atony, early PPH, prolonged labor, very rapid labor, over distension of the uterus or excessive enlargement of the uterus, the use of oxytocin, or pitocin or other drugs or general anesthesia during labor, induced labor, then high risk of atony of the uterus if delivering multiples such as twins or triplets. Baby is much larger than average, which is called fetal macrosomia, older than 35 years old, obese, have too much amniotic fluid, which is called polyhydramnios, had many prior births. Uterine atony can also occur in women who don't have any risk factors. Laceration, early PPH. Causes of laceration: poor tissue approximation or poor surgical technique, obesity, anemia, poor perineal hygiene, blunt or penetrating trauma, inflammation, bowel disease. Risk factors: first delivery, the position of the baby, face up deliveries, a large baby more than 8 pounds. Retained placental fragments, late PPH. There are 3 causes of retained placenta: not enough contractions, the placenta grows into the uterus wall, early delivery, giving birth many times, previous surgery in the uterus, being born with uterus deformities, having oxytocin medication for too long. Who is at risk for a retained placenta? Being over age 30, giving birth before 34th week of pregnancy, having a premature labor or delivery, having a prolonged first or second stage of labor, having a stillborn baby. Subinvolution late PPH causes pelvic infection, inflammation, endometritis, retained placental fragments. Risk factors: long labor, anesthesia, full bladder, difficult delivery, maternal infection. That's all.
Good day everyone, I am Melos Patalan and today I will be discussing the signs and symptoms of postpartum hemorrhage. So let's start with the uterine atony. So this happened during the early PPH. So first is the uncontrolled bleeding. So this is the heavy bleeding from the vagina that doesn't stop or slow. So we can tell that the patient is qualified for PPH if ang iyang bleeding kay mo abot o more than 500 ml for the vaginal normal vaginal delivery and more than 1,000 ml sa cesarean birth. Next is decreased blood pressure. So dira ni maba iyang blood pressure. Next is an increased heart rate. Nisaka iyang heart rate, backache, the patient maka-experience og sakit sa iyang back portion. Nausea, feeling sick to your stomach or throwing up. Kasukaon. Next is pale skin or manluspad, and it is also because ang iyang blood pressure ni or ang iyang blood flow ni maba. Swelling, mo ni siya ang pain na ma-experience sa patient from sa iyang vagina or perineum and nearby area if bleeding. So perineum is located in between the vagina and the rectum. So and lastly is the tense and rigid uterus. So dira nga part ang uterus dili na flexible or dili ma-stretch, and that also indicate nga naay internal bleeding nga nahitabo. So next is the laceration. So mahitabo ni siya during the early PPH. So, the patient will experience fever, pain around her vaginal area, and then persistent red lochia. So when we talk about lochia, this is the vaginal discharge that you have after the vaginal delivery. So persistent, continuous vaginal discharge. Next is foul-smelling vaginal discharge. Pagka nga vaginal discharge, naay lain nga baho. And na siya sign, usa sa sign na naay laceration na nahitabo. And then retained placenta fragments. So mahitabo ni siya during the late PPH. So again, the patient will experience fever. And then foul-smelling discharge from the vagina that contains large pieces of tissue. So diba sa lacerations dapit hanang foul-smelling ra, pero sa retained placenta fragments na naanay mga particles or pieces nga dagko nga maapil. So I think mura na siya mga unod-unod or inana ba. And then the patient will experience heavy bleeding that persists and severe pain that persists. So heavy bleeding that persists and bleeding na continuous, and then severe pain that persists, severe noon ang pain pero kuan ra nang continuous nga lang. And lastly, the sub-involution, and it will happen during the late PPH. So first, the patient will experience pain and feeling of tenderness or heaviness in both breasts. So diri na part maka-experience ang patient nga maka-experience siya kuan ng pain and discomfort whenever matouch ang iyang affected area, which is the breast. And then generalized malaise, diri ang patient maka-experience of uneasiness, discomfort, and dili niya ma-explain kung ano inato ang iyang na-feel. And then transient rise of temperature. So dire nga part makalitrag taas ang iyang temperature and then mabalik na sad sa normal. And lastly, painful breastfeeding. So whenever magpa-breastfeed siya, masakit ang iyang breast.
Hello everyone, I am Jerlyn Cucabel and I will be reporting about laboratory and the diagnostic exam. So first is the uterine atony. Uterine bleeding is seen in this ultrasound. This case of a woman with postpartum hemorrhage can lead to a surgery called uterine artery embolization. So in the ultrasound shown, uterine bleeding is visible. So in that case, women with early postpartum hemorrhage will lead to a surgery called the uterine artery embolization. So this is a procedure that treats fibroid without surgery. Instead, the doctors or the radiologist uses special imaging methods to treat the uterine fibroids. So what is uterine fibroids? Uterine fibroids are non-cancerous growths of the uterus that often appear during childbearing years. So during this procedure, the blood supply of the fibroids is cut off. So it causes the fibroids to shrink. So next is the laceration, the cervix, perineum, and vagina. So this is an ultrasound of laceration of the perineum. This procedure occurs when vagina doesn't stretch easily. It seems the cause of these are obesity, blunt, and inflammation bowel disease. So the line is seen to be tearing off. So some tears are more extensive and require treatment. So inflammation bowel disease, it is an umbrella term to describe disorders that involve chronic inflammation of our digestive tract. So there are two types of inflammation bowel disease, which are ulcerative colitis and Crohn's disease. So in the ultrasound that shown, laceration is on the perineum. So some causes of this are obesity, blunt and inflammation bowel disease. So the next is, in order to prevent laceration, mothers are advised to exercise. Like example, squatting or retained. So next is retained placental fragments. Retained placenta is seen in this ultrasound. It will be removed by hand or the manual removal by the doctor. So it is serious and not a common condition. But there are many causes such as not enough contractions, the placenta grows into the uterus wall, and early delivery. So having surgery of or a manual placenta removal can have many risks. Some risks like that includes infection and life-threatening bleeding. So it can also cause endometritis, which is an inflammation in the uterine lining. So if the placenta, or there are pieces of placenta that is inside your uterus, it can also develop infection. So manual removal or manual placenta removal is advised. But your doctor may give you some antibiotics to stop or help stop these infections that I've mentioned, like infection and endometritis. So next is subinvolution. Subinvolution is when a uterus does not return to its normal size. So methods for treating this case include conservative medical therapy and hysterectomy. Excuse me. So conservative medical therapy can be defined by the avoidance of invasive measures such as surgery or any other invasive procedures. There are types of conservative treatment like bed rest, exercise, therapy, and etc. So hysterectomy. This is a surgical procedure to remove the womb. But after removing the womb, you'll be no longer be able to get pregnant, and if you haven't gone through the menopausal stage, you will not have your period. So this is common to aged 40 to 50. So if you're subinvolution, so these methods are only applicable to when your uterus does not return to normal size. So that's all for laboratory and diagnostic exam. So prevention. Uterine atony of early postpartum hemorrhage. One of the members of the healthcare team make a uterine massage after the delivery of the placenta. So giving prenatal vitamins, including iron supplements, can help prevent anemia and other complications of uterine atony and hemorrhage after delivery. So most commonly iron supplements like ferrous sulfate or so give uterotonic drug or oxytocin after the delivery can help the uterus contract. Next is advice to the mother is to make some exercise or any other small activity and maintain a balanced diet before giving birth. Most gina-advise naman na mag-exercise ang mga pregnant women, like squatting. So to avoid atony of the uterus, the mother should advise to deliver the baby in a hospital or center that has all adequate equipment to deal with blood loss. So gina-advise na sa mga midwife or any healthcare workers nga sa dili na sa balay mga anak ang pregnant women, wala naman ay kay naamay uban jud nga mag-bleeding. So, dili nila makakuan kay wala man sila adequate equipments kung pagsabalay lang sila. So, it is important to give birth in a hospital or center. Laceration. Give instruction to the mother during labor on what position to put to have less pressure on the perineum and vaginal floor, like upright squatting or side lying. So, this position can help lessen the pressure in the perineum nga maka-prevent siya kuan nga laceration. Giving a massage on the perineum in the last week of pregnancy during labor can also prevent laceration. Advise the mother to exercise daily before giving birth. So, talk to your birthing coach ahead of time so you agree on when and how hard you should push. So talk to your birthing coach kay naman joy uban nga mga samot na pag teenager or first baby dili sila kabalo mo iri like sige pasagap mo sige ra sila unto then hantod kapuyon na sila. So it is important to talk to your birthing control or kanang mukuan ka like mukuan ka unsaon pag push para aning dili kadaling kapuyon and para pud dili makalitan ang kuan para ning like para maka-avoid pud siya magisian makalitan imong kuan niya maka-avoid kag laceration. So retain placental fragments. Routinely giving medications like oxytocin at the time of delivery to help the uterus contract. So pwede pud ni siya after delivery to help the uterus contract. Giving an adequate iron intake and red blood cells during pregnancy. Again, the iron supplements like the ferrous sulfate. Advise the mother to start breastfeeding the baby as soon as possible after giving birth. This is because breastfeeding makes the uterus contract and is a natural process that will help prevent a retained placenta. So, kabantay galitaan ng human og paggawa sa bata kay gihatag dayon siya sa iyang mama para ma-breastfeed siya. So, next is advice to the mother to exercise daily. Common na kayo nga advice nga dapat ang mama mag-exercise jud siya before giving birth. Sub-involution. Giving the mother an oxytocin by injection into a vein or into muscles during labor. Initiate the mother to have breastfeeding early. Same, it's like what I've said earlier. Oxytocin gi-inject na siya sa mama during labor after human na siya panganak. I-inject na siya tas initiate the mother to have a breastfeeding. Buto padideon ang bata.
So once again, this is Vanji Bulay. So first would be nursing assistant responsibilities. So first would be then uterine atony or early PPH. So uterine atony, it refers to the failure of the uterus to contract sufficiently during afterbirth. It can occur during both vaginal and cesarean delivery. So first is monitor the vital signs of the mother. So kinahanglan to siya i-monitor, most especially the body temperature, kung gilandan ba siya or wala, pulse rate, if normal ba yung pulse rate, respiration rate is for the breathing of the mother, and then the blood pressure. So kinahanglan po nato ni siya ikuan ang i-check ang iyahang blood pressure. So next is prepare the materials needed for the procedure. Then, assist the patient for every intervention of the nurse. So, kinahanglan nato ni siya, ang mga materials kinato i-andam. Dayon, atong i-assist ang pasyente for every intervention sa nurses. So, next is the laceration or early PPH. So, laceration, it is a deep cut or tear in the skin or flesh. So, if we're going to, or if I'm going to talk in a vernacular language, lalom ni siya nga samad o gisi sa panit o unod. So, perform perennial care to prevent bad odor and to promote comfort. So, kinahanglan nato na si mother ato siyang ikuan og perennial care. To alleviate the anxiety and embarrassment of the patient, I properly explain the procedure to the patient and establish rapport, which is having a good relationship towards with the patient and the nurse or the nursing assistant, and also the doctors. And trust with the patient as well as with the significant others, most especially the husband or the partner of the woman. So, kinahanglan po nato nga musalig ang usa ka tawo or usa ka pasyente nato, ug kay para pod ang atong pasyente is dili sila magduha-duha nga if ever natin mga procedure nga himuon sa ilaha, mugo ra jud sila. Then, observe the presence of lucha. The next would be the giving the patient a heat lamp treatment. So, kinahanglan po nato na siya moan po ta og heat lamp niya, heat lamp treatment. Because it promotes healing through enhancing blood circulation and reduces swelling and inflammation in the site and may relieve pain and muscle spasm. So, next is identify the patient and explain for every procedure that you make to help in minimizing anxiety. So, kinahanglan jud nato siya for example, nata sa sitwasyon no. Ato nun, ma'am, ayong buntag, ako daay si Vanchi Bulay. Ako ang imong nursing assistant karon. Karon ma'am, is mukan ko sa kaninga procedure, ug usa nga procedure ang sa patient. Para pod si patient makabalo og kinsa ka, makabalo pod siya og unsang buhaton para niya. Then, checking the doctor's order for every intervention. So, kana po siya, dili siya nato siya kalimtan na we need to check the doctor's order, which is we need to follow so that dili ta makasaban sa doktor, and then ang atong procedure is go to the floor ka ng balimer, walay mga sabas-balay example nga sakto atong gipanghimo. Then, preparing the materials needed for giving the patient a hot seeds, and educate the mother why she need this procedure. So, kinahanglan po nato ni nga ato yun si mother nga, ma'am, kani akong baton sa imuha, o kani siya ma'am is makatabang ni siya para sa imong kuan, like for example sa katong heat lamp, which is to reduce the blood circulation and then reduce swelling and inflammation. So, mo to siya. So, ato siyang inon every procedure. We should never forget to tell the mother nga, ma'am, ingon ani mo siya makatabang sa imuha, so kinahanglan ma'am mo undergo ta ani nga procedure. So ato siyang i-explain hinay-hinay para makasabot si mama. And then perform cleansing bed bath to the postpartum mother. So next is retained placenta fragments. So it is when the placenta is not delivered within 30 minutes of the baby's birth. So, kinahanglan ni siya is report any significant findings. So, kinahanglan ta mo report ug unsa ang kuan sa mama. So, para pud ma-aware ang mga doctors and nurses. Then, assist patient for everyday exercise or distance. So, kinahanglan pa to i-assist si mama para pod si mama is makahinay-hinay na sa pag-recover. Then, next is subinvolution or late PPH. So first would be report abnormal pattern like fever, pain, persistent, red lotcha, vaginal discharge. Then prepare for possible surgical intervention. So kinahanglan pud ni siya is atong i-monitor si mama kabayan ingon ana kay tungod para pud ta nga maka-report og unsay kahimtang ni mother. Dayon matagan ko siya tambal para ma-okay si mama. Okay, that is all. Thank you.